Victoria, I admire you, I love you, and I respect you. You are really one of my heroes, and I feel so blessed to have you as my girlfriend. Ladies and gentlemen, Victoria Jackson.
Gosh, thank you so much, Sherry. That was beautiful, really beautiful. It's nice to be here today. And sometimes I guess I'd say it would be not nice to have to be here today. And, but I'm really so grateful that all of you have taken the time to come here and to listen and learn a little bit about NMO, as I've had to sort of turn my brain inside and out since we've gotten this diagnosis 2 years ago. Bill and we have 3 children. I have a son who's 25 and my daughter Allie, who's now 17. So this has really been all the efforts in the last 2 years, and my son Jackson, who's 14. And I've always was, a mom. I was blessed, still blessed with 3 beautiful children that were healthy. I don't think I ever really had to deal much with a decision of more than a Tylenol, for healthcare problems. So I felt very lucky. And my husband and I, self-made entrepreneurs, we've pretty much, worked our way up, and we've done the work, and we've been grateful for all that we had. And then one day my daughter said that she was suffering from this. We came back from a trip, and she said she was suffering from an eyeball headache. And I thought, well, okay, let's think about that. What's happening? And over the next couple of days, she started to lose her vision. Excuse me. And I thought, well, we'll go to the eye doctor. Maybe this is the eye drops, an eye infection, and basically we went to the eye doctor, who said you need to go see somebody that's a little more equipped to really take a look at. Looks like something's going on with the optic nerve. Turns out she has optic neuritis. I have no idea what optic neuritis is, and he tells me about the inflammation, and he says, but we really need to find out, why is this young, beautiful 15-year-old girl now dealing with optic neuritis? And he then sends me to another doctor who says, I'd like you to go to this neurologist, and I'd like him to do, a lumbar puncture, a spinal, the tap. And I thought, well, gosh, I don't really get that. She's got the eye thing, so now why do I have to do that? And he, says, I want to see if there's something else that's going on. And I said, well, I'm a little nervous about that. He said, well, let me just take some blood tests then. We'll run some different tests. And he goes through this sort of litany of all the tests he's going to do. And there's one test that he's ordering, and it's called NMO, neuromyelitis optica. And I said, oh, what's that? And he goes, oh, don't worry about that. That's just, it's just, I don't even know why I'm running it. I've never run that test, but let's just run the test along with all these other tests. Of course, we'll fast forward to the test come back. It comes back positive. That's a test that goes specifically to the Mayo Clinic. And I see it marked positive, and I'm like, well, what's NMO? We now hear from the eye doctor and the neurologist, well, this is Devic's disease. They start explaining it. And the way that it's presented from one of the doctors tells me that basically you could have 4 more years with your daughter, and there's a good chance that she's going to be blind and paralyzed. Well, obviously, those of you, your parents, you're compassionate people, life changes in a minute, just like that. And he goes, and if this was my daughter, I would get to the Mayo Clinic, like, right away. I've never, I read about the Mayo Clinic, I've heard about the Mayo Clinic. You don't ever think you're really going to the Mayo Clinic. So I then, my husband and I, basically, we didn't sleep for many nights. We cried, and we didn't want to freak out my daughter. We didn't want her to know, so she'd be, what's wrong with you guys? And we're like, well, we're just sort of figuring the eye thing out. And, off to, now it's spring break, and because it's falling right in that week, we're now off to the Mayo Clinic. We go to Rochester, find out that there's one man. I find out that he is the one who knows about NMO. He's doing the work in this. It's a very limited, not much known about it. He's the only guy. So I'm thinking, okay, we're now on the sojourn, the journey to the Mayo Clinic. There's one doctor named Dr. Brian Weinshanker at the Mayo Clinic in Rochester who knows about Devic's disease and NMO. So I'm thinking, now do I not only have to keep this sort of white light around my daughter, I've got to protect Dr. Brian Weinshanker, the only man who knows about NMO worldwide. And we get there, and I meet with him, and he's a very compassionate, wonderful man. The Mayo Clinic is just set up fantastically for us and very, very helpful. And, you know, it's Allie's first sort of dealing, but not really dealing. We're in the MS center. Why are we in the MS center? Do I have MS? People are coming in all different conditions, obviously, as you all know. And he basically tells us about this and what we can expect, and Allie's vision is getting worse and worse, and now she's almost lost a good amount of her vision, her color in one of her eyes. She's in pain, and he says you can probably expect within the next 3 or 4 months she'll have another episode, and that will be one that will possibly either come back this way into the eyes, or it will affect her spinal cord. So I was like, no, you know, what if you have this wrong? You know, of course, the mother in denial a little bit. What if you have it wrong? What if she just has this one-time occurrence? Sends us home, but I do say to him before I leave, I said, let me ask you something. Are you doing any research in this field at all? And he says, well, a little bit. And I said, okay, well, a little bit's not going to really work for me. So you're going to be doing a lot of it, because I'm a mom with a checkbook. You're a fantastic doctor here at Mayo Clinic with a fantastic mind and a passion for NMO. So you and I are going to get to know each other, and we're going to cure NMO. And he looked at me, and I'm sure he was trying to figure out, you know, poor dear, whatever. And, you know, I leave, and sure enough, a few months later, Allie had her first spinal attack. She was in extraordinary pain. You know, it manifests always very differently in the body, and, you know, now really the ride has begun. She's on steroids, IVs, you're in MRIs. I mean, the reality changes. So I know all of you, there's always that question we have in our mind, what would happen when something happens? What do you do? What do you do? You can do what we did for a while, my husband and I. We kind of laid down, we cried, we had a really difficult time thinking, wow, can we really be losing our daughter? And we're still having to make sure that Allie's going about her life. And I said, no one's going down on my watch. It's not going to happen, okay? So I'm going to now close the book. My whole background has been in the world of beauty. I was on infomercials for 14 years. I've sold about $500 million worth of products on TV. I was completely self-taught, didn't graduate high school, didn't go to college. Really a businesswoman from the grounds up, learning it as I was doing it. Spent a lot of time in a lab making a lot of lip gloss and products. So I thought, okay, I will now have to go from mascara to medicine. I will close the book. I'll bring a lot of, as I have from my visits to doctors all over the world, a lot of the women in labs have a lot of lip gloss when I show up at the Mayo Clinic, so I still bring a little bit of my old life into my new life. But I basically said, I will now channel everything I've learned. I was always sort of a goodwill ambassador for the power of mascara. I was the goodwill ambassador for looking better, feeling better about yourself, and that's how I reached women. So I thought, okay, I'm going to channel everything that I have learned, and I'm going to learn all about NMO. Well, it's interesting, the things that come back to you, like all of a sudden you realize, wow, as you're sitting there going and sitting with scientists that are hand-picking scientists that I think are going to be helpful along this journey, because I've also realized, wow, I ditched school a little bit and I didn't really follow the science classes quite to the extent that my brain is now going to need to have to be functioning to learn the science. It became very apparent to me very quickly that I was going to have to become also not only just mom on a mission, or as my friend Jessie sitting there says, just mom on a mission doing everything right. I'm also going to have to become Dr. Mom. I'm going to have to learn the science, because I'm going to have to really understand what is going on. So I now have brought together I start with Dr. Weinschenker at the Mayo Clinic. I'm working with Dr. Katja Van Hurley, who's not here today, but who is really an extraordinary support for me throughout this whole process. And we now start going out to the community of what I'm going to put together as my advisory team. So I put together an advisory team of people that I think are going to be the best in helping me decipher, sort of wade my way through all of this science and really come together around this with great hearts, great intentions, and great minds. And so I start forming this team together of advisors. And I start learning, okay, I'm going to need somebody who has a specialty in B cells, in T cells, in astrocytes, in cytokines. I mean, the science is expanding, and I'm sitting in my first meeting that I went to at Stanford, I'm bringing my team of scientists and researchers, and for me, sitting in the room, keeping up with the game, I can feel smoke coming out of my ears just to learn and maintain, but I have learned every single thing there is that I can about NMO, about the science, where things are working, orthogonal array patterns, upstream, downstream, and I've really found that if I can learn the science, but take what I do best as well, which is, as a businesswoman, I have a way of looking at things from all different perspectives. And I have found, working with so many of the great minds in these institutions, they're really great at maybe working on the science, but they don't know how to organize. They don't necessarily collaborate. Well, here's also the beauty of collaboration. When you're the sole funding stream and it's your money, and it's your child's life on the line, oh, people will talk. I mean, it's like, no. I'm saving my daughter. You're all here. This is why you got into medicine. We're going to do this. And they saw that, okay. And the interesting thing is when it is a rare orphan disease, and I always say there's stand up for cancer, but this would have to be jump up really high for NMO, would be our slogan. You find that I brought all these doctors together. I went to Stanford to find out, I'd find out who was the most extraordinary person working in the world of MS that was looking at NMO and maybe from a different perspective. And I would seek these people out. And I went to see each one of them and I said, I'm going to have a symposium. This was all within 6 months of my daughter's diagnosis. And I'm going to bring you all together to meet. And I brought them all together to a hotel here in Beverly Hills. Of course, as it would be the night before my daughter had a really bad attack. It's interesting how the universe serves those things up to sort of make it really poignant for you so that you could be up all night and then have to stand in front of people and you sort of just pour out your heart and you tell them what's going on. And all these doctors showed up, all working on NMO in the world in little pockets that have never really been connected. And I said, okay, everybody in this room is doing something in the world in which I'm working. So now we're gonna all work together. We're gonna put this together and we're gonna start building. And by the way, because this is a rare orphan condition and it's small and there aren't 80,000 things going on, we can actually do something here because it's my money. I'm gonna make decisions intelligently, quickly, swiftly. We're gonna do it, we're gonna have follow through and everybody's gonna talk. And it's just been rather extraordinary how it's been working so that everybody's kind of come together. They introduced themselves, they started to present their work, and it's just been extraordinary. I have, during the year, I have a time where I bring them, I have a ranch, I bring them together, I feed them lots of guacamole, and I go, okay, no one's leaving this weekend till you tell me the 10 new things we've learned and we're moving forward on. And they're working together. You're seeing Stanford's working with Hopkins, working with Mayo, working with Harvard, little known, unknown investigators, people that have the passion for it. And it's extraordinary what can be done when people are willing to communicate and come together around something. And that's really what this journey has been for me about, is really getting the greatest minds together, getting people to learn about it. And what I'm finding, through this whole process, at some point, my daughter learned that she had NMO. She used to watch on television mystery illnesses to see, and she'd come in the room, I think I have Reiter's syndrome, or so at one point she was ready to hear about what she had. And she looked at me and she'd see the work that was going on and she'd go, Mom, this really isn't just about you and I anymore, is it? And I went, no, it's not just about you and I. I said, you know what, Allie? You weren't looking to be the poster child for a rare orphan disease, and I don't know that at this point in my life, if anyone would have told me at this point in my life that I would be curing a rare orphan disease or doing anything like this. I've been working since I'm 16. I thought I'd have some pool time now to figure out what I want to do. I used to, have a whole different life. So I said, but you know what? Somehow it's worked out that this is what's before us. And again, it's like, what are we going to do? What do? You pull yourself up, you figure it out, and you keep moving forward. And she looks at her condition. She has gone through maybe, 50-something MRIs, I don't know, 70 IVs. I mean, I could go on and on with the statistics. She'll do it, she looks, and she still has managed to be captain of the tennis team, editor of the school paper, straight A's, because she just keeps moving forward. And she says, I don't know what the big deal is. It's more like a lifestyle than a disease. That's how she looks at it, and that's what allows her to keep going forward. And honestly, if she walked in here, and I will at the end of the close of my time, have you look at the 2-minute little video I made. I promise just 2 minutes of Allie and what I've done here, but of how she has just soldiered through it. And so she's that inspiration for me. And I'm going to play for you, and then Dr. Michael Yeaman is going to come up and speak, and then Dr. Ben Greenberg. They are extraordinary. Dr. Michael Yeaman, who has been with me from the beginning, is fantastic. He really oversees the breadth of the portfolio of what you can see has all been done in just the last 2 years. And Dr. Ben Greenberg is not only Allie's doctor, who I am so blessed to have because he's extraordinary, compassionate. All of the people that work with me are just really compassionate people that are extremely knowledgeable and very dedicated, but just good human beings. And then obviously Candace. When you have something like this, and Allie was diagnosed, I did want to just see anybody else that was like living that had this. I was like, is there someone I could just see and make sure that they're still walking and eyeball them? And it turned out that I was introduced to Candace, who the day that I met her was friends of hers were doing a fundraiser for her to get stem cell treatment in India. So it's all interesting how now, just shortly 2 years later, Candace and I are sitting in this room for stem cell. What I want you to do is you listen to this presentation and think, my husband and I have been certainly carrying this on our backs. It's in our hearts. We are the sole funding stream for this, millions and millions of dollars, pledges, things. I monitor it. I am not just a check writer. I monitor every single thing that's done because I am that mom on a mission who's going to find a way to figure this one out. I would love you to consider this. I think this is fantastic, and the importance to really be thinking about, and I know I'm constantly reminded from my researchers now, is this is not just affecting the research I'm doing in the world of NMO, but the differences it's making in MS, lupus, because of all of the connectivity between all of them, as you know. So I think I'm trying to set an example and a different way of thinking on how we look at disease and how we can think about curing it. I'd like to have you take a look at the next 4 minutes. Here is a piece that I put together with Mr. Jesse Dillon, who is here today, with a lot of the experts that I have come together on this. So thank you.
An orphan disease is a disease for which there is no good therapy. Most orphan diseases happen to also be rare diseases. The relationship there is that there hasn't been as much effort to identify cures.
There's about 7,000 orphan diseases and maybe about $16 million allocated through the National Institute of Health for orphan diseases. Until we have a solution for any disease, we actually have to say they're all without a home.
NMO stands for neuromyelitis optica.
An autoimmune process of the central nervous system that affects the optic nerves and the spinal cord.
The symptoms of optic neuritis are blindness. The symptoms of spinal cord involvement are paralysis.
He told me on the phone that I could probably, I might have 4 years with my daughter before either she wasn't with me or she could be blind or paralyzed.
I've always felt like it was just us who had this. Always us. Our doctor had made a joke and said, we're going to say you have your own disease.
People think, oh, you're faking this. You're not really that tired. Or, why do you feel good one day and not another? When inside your body there's some serious stuff going on.
Right now, NMO is thought to be a very rare disease.
It's about 1 in 100,000.
Neuromyelitis optica was considered under the umbrella term of MS.
We used to call it Devic syndrome, and it was a constellation of neurologic abnormalities.
We know now that one of the primary causes relate to antibodies that are directed against a certain structure.
The neuromyelitis optica antibody we discovered by chance in the clinical laboratory.
The three of us didn't really quite realize exactly what the other one was doing. We kind of shared our data, and then Vanda recognized this unique pattern around the vessels.
We were looking for a new water transporting protein, and it turns out quite accidentally that this protein is the target for NMO IgG.
There's no accidents. It's hopefully the insight to see what the accidents are, and this is how it can actually link up with another one.
The NMO story is a great example of being able to take a group of patients that may have been misclassified as multiple sclerosis and giving them their own name, their own face, their own biology, and ultimately their own treatment.
The work that I have seen Victoria do over the past few years has been extraordinary.
And it does take a leader to stand up and not just talk about awareness, but to follow through.
When you're a mom on a mission and it's your child and you feel there's some kind of a clock going, people are going to talk.
Find the best, talk to them, but insist they talk to each other.
That's exactly the kind of meeting like the Guthy-Jackson Symposium.
Bringing these doctors together so that they can converse and share ideas.
You get to hear what other people's work is, and then you can see how it fits with your own.
To see the work that's gone before, maybe build on that, not start from scratch.
We understood that there was a dramatic drive to create collaborations, and so at the moment I'm collaborating with about 20 different national and international groups.
These include structural biologists, immunologists, neurologists, epidemiologists,
people from Johns Hopkins, people from the Mayo Clinic, people from the University of Texas Southwestern.
Other labs, for example, at Stanford are working on B-cell responses, and we're working on T-cell responses.
We've developed a collaboration with Alan Berkman, who's just several floors up.
And before the NMO Foundation identified us and brought us together, we didn't know about each other's existence.
I've never seen this kind of organization and cooperation among leaders in the field.
We all recognize it's going to be a group effort.
I think the technology that is going to have the greatest impact on our learning about orphan conditions, and for that matter, all conditions in healthcare, is the technology that connects people globally through networks.
We're living in a computer age, and despite that, this has never taken place yet.
This is a blueprint for a cure of potentially all autoimmune diseases.
It'll have an impact on how to approach treating those diseases. It'll have an impact in terms of methodology.
The idea is putting together all these orphans, collaborating between them so that we can answer questions that apply to as many people as possible.
Now we're talking about things maybe that we never thought would have anything to do with one another, but in fact they do, and we only know that because we shared information. I would carry that analogy beyond having a flashlight or two flashlights, beyond turning the light on in the room to the sun coming up.
I know that when you put your mind to it, there is nothing that you can't do, and I'm not going to stop until I find a cure for this and a model that really works for people and for the world of medicine to change it.
I also just want to, before I'm going to bring up Dr. Michael Yeaman now, I do want to as well think when you do something like this early on, my husband and I decided who would be the funder and who would be the finder. So I could not do any of this without my husband's funding, so I always thank him, and I'm grateful because he writes huge checks.